And I was surprised to watch you on Twitter, Doctor, because it appeared that you were also applauding this decision at the same time that I saw a number of other doctors saying that this is going to lead to needless deaths.
Yeah, well, we've talked about this several times, and what I said on Twitter was consistent with the discussion we've had. I've always thought that this was a bridge too far in terms of the divisive nature of it and the opposition that it would engender. You're now seeing political lines form. You're seeing the issue of vaccination become an overtly political issue, in part because of opposition to this mandate. And my question all along was, how much are we going to gain from a public health standpoint for that opposition? And my concern was that that opposition would eventually bleed into other vaccine mandates that we've long taken for granted, like childhood immunizations, and you'd see rates of childhood immunizations and other things come down. The reality is we have 85% of adults vaccinated with at least one dose. We'll probably pick up another 5% along the way. And I'm not sure that this mandate's going to get us much more. And from a public health standpoint, many of the people who remain unvaccinated at this point have had COVID not once, but probably twice. So you have to ask yourself how much you're achieving, especially in an environment where the vaccine efficacy against reducing infection has been substantially reduced against Omicron. Now, that may be reclaimed as we formulate new variant vaccines that target Omicron specifically heading into the fall. But right now, using vaccination as a tool to try to avoid transmission in a congregate setting, while not completely eviscerated, we know that the vaccines reduce transmission. They don't reduce transmission nearly as much as they used to. So we need to be upfront about that and be upfront about what we're trying to achieve with these policies. Final point here. The Supreme Court left the door open. They said that the current regulation doesn't really draw a distinction between the kinds of settings that you'd be trying to protect through vaccination, which does leave the door open for the possibility that the administration could recraft this regulation and be more specific about the kinds of congregate settings that they're trying to use the vaccine to try to protect.
Dr. Public policy question, which is absolutely, I agree, especially when it comes to Omicron, that the vaccine clearly does not prevent transmission, or at least doesn't limit it as much as you'd want it to be limited. However, it does appear to limit symptoms, to limit the opportunity to go to the hospital and the like. And in a peak scenario like we're in now, where you have some hospitals being overwhelmed by it, and therefore the cascade of ramifications, not just on those who have COVID, but anybody who needs medical attention. The question is, how should society and how should businesses think about that?
Right. Look, and I agree with that, but I think we need to be very explicit about what we're trying to achieve, because our policies may change as the technology changes, as the circumstances change. And if we're upfront about the tools we have, what they can do, and what we're trying to achieve from a policy standpoint, it makes it much easier to change the policy as the facts change. The bottom line right now is that if you're mandating a vaccine for a congregate setting, you are going to reduce the risk of transmission in that setting, but not nearly as much as you would have in an age when there was Delta. But there may still be a compelling reason to try to get that incremental risk reduction, or you may want to mandate vaccination because, to your point, you want to reduce the risk that people within your workforce, people within your community will progress to severe disease that will put a strain on local healthcare systems, that will cost you direct outlays of money, that will take your workforce out for an extended period of time. So there still are compelling reasons why you might want to mandate vaccination in a workplace setting, but we should be upfront about what the vaccine will achieve and what we're trying to achieve from a policy standpoint. Right. Again, it may change in the fall. So if we're upfront now about these things and say, look, it's not as protective as it used to be around reducing transmission, but come the fall, it may be protective again at reducing transmission, or very protective, we may say in the fall, we're going to reach back to these tools and try to re-implement mandates.